A hernia is a defect in the abdominal wall where your internal organs protrude through it, meaning your intestines or your liver or your fat, and it's something that you either are born with or you develop through just through aging process, or you have an intra-abdominal process that's going on that's increasing pressure, which makes the abdominal wall weaken and have your internal organs protrude through. The most common hernia that's seen in women is inguinal hernias, but women also get femoral hernias, incisional hernias. Incisional, I mean that if they had previous surgery, they can get a hernia from that incision site. Sometimes when someone has a hernia, they don't realize that they're having a hernia and they're not sure what they're feeling. They might feel a mass, they might feel firmness, they might be constipated and not sure why. So when anyone does present with a hernia, you always do a workup to make sure that there's not underlying cancer. For example, if you have lung cancer, you could be coughing a lot, and that can increase intra-abdominal pressure, which could cause weakness in the abdominal wall. If you have colon cancer, you could be straining to have a bowel movement, and because of the straining, you increase intra-abdominal pressure, and you can develop a hernia. You could have ovarian cancer, and fluid fills up in your belly, increases intra-abdominal pressure, and it also creates a hernia. You'd hate to miss a cancer, repair your hernia, and then it would reoccur. The signs and symptoms of a hernia is you feel a bulge that sometimes you can feel it and you can push it back in. That's called a reducible hernia. Sometimes you develop a hernia and it protrudes out and you cannot reduce it. And if you can't reduce it, and prior to which you were able to reduce it, you can get incarcerated where your intestines stick out, and you have within 6 hours to get that repaired because it can reduce the blood supply to your intestine, and that's where it can become gangrene, it could perforate, and you could die from infection. The other problem you could have with hernias is that it's painful. You can have nausea, vomiting, maybe not be able to have a bowel movement because your intestines are strangulated in that hernia. There's multiple ways of repairing hernias. You could do it laparoscopically or you can do it open. Here at Sinai-Grace, we can actually repair them laparoscopic, open, or robotically by Da Vinci. In repairing hernias, you can place meshes in, which normally they do require because most hernias are very large and you need some form of mesh. One of the meshes that we use here is called Pro Grip. It's like putting Velcro on the hernia site, actually, and you don't need to use suture, which is one of the benefits because sometimes utilizing suture you can actually entangle the nerve, which causes chronic pain. Now they're so lightweight and durable that they're placing them in and patients seem to be returning to work quicker. They don't have the dissatisfaction of pain or feeling the graft inside their belly. Ways to avoid a hernia from recurring is making sure that you don't gain excessive amount of weight. You want to keep your BMI less than 30. You want to avoid smoking, heavy lifting. Once you get your hernia repaired, you want to avoid any heavy lifting for 6 to 8 weeks so you don't stress the repair. So it's important to realize that if you have a hernia, seek medical attention so you don't have the complications from having a hernia.